Hi Emma, how you doing today?
I'm doing good, thanks. How are you?
I'm doing well, thank you for asking. I understand that you've come here today because you've had some symptoms that have been bothering you.
Yeah, I have anxiety sometimes, and I've lost about 3 jobs within the past year.
You've lost 3 jobs in the past year. Is it because of the anxiety?
Yeah, well, I'm scared that something's like gonna happen at my apartment.
Mm-hmm.
So I need to unplug things, but it has to be in order. So when I unplug things, it has to start with like the TV, and then my computer, and then my phone, and then the lamps, and then I've been late to work.
All right, so you have a system you go through of unplugging
Yeah,
different objects in your apartment, and you're worried that they're going to cause a problem if they're left plugged in?
yeah. Like if they overheat, it could like burn it down.
You're afraid that if you leave them plugged in, they'll overheat
Yeah.
and your apartment will catch on fire.
Mhm.
And you have a particular order you go in as you unplug?
Yeah.
What happens if you're unplugging the items and you get distracted or something interrupts that?
Oh, well, I mean, sometimes I'll get like a text message and I'll hear my phone go off.
Mm-hmm.
I'll have to just start all over again.
Will you plug the objects back in, or how will you do it for the items that are already unplugged?
I would just have to unplug them, and then I would have to plug them back in, or vice versa.
So you go back and plug them in
Yeah.
and unplug them.
Mhm.
What's your anxiety level like as you start that process?
It's really bad.
Is it?
Yeah.
How about toward the end of the process?
It goes away,
Mhm.
but it's just kind of temporary, just for a little bit of time, and then it comes back, and I have to go check it again.
Okay. So when it comes back, everything's unplugged.
Mhm.
So you have to plug everything back in and unplug it
Yeah.
and go through the whole process again.
Mhm.
All right. So it's pretty distressing.
Yeah.
Yeah. And you think that this is what led to the problems with employment?
Yeah, because I also I have to lock my door, but I like to lock it 12 times. So I'll put the key in, and I'll hear it click,
Mhm.
but then I just like doing it 12 times just to make sure it's locked. And that made me late for work. And then when I was at work, I have a drawer. I'm a cashier.
Mm-hmm.
So I would just make sure it was locked, but I would have to do it 12 times just to make sure it was locked. And I didn't get back in time to like help the customers.
All right. So your employer wasn't happy with that.
Yeah.
Yeah. And that led to you losing your job.
Yeah.
Are you working now?
No, I had a job for a little bit of time. It was, again, a cashiering position, but I was on break, and I was like in the room, and I had the lights, and I just wanted to make sure like they would go off all the way, just because I didn't want to leave the light on.
Mm-hmm.
And by the time I got done turning them on and just make sure they were off, I didn't get back in time on the floor, and my employer just said I wasn't a good fit.
Wasn't a good fit. All right. So these symptoms have caused you some real problems
Yeah.
with employment. And how about with your anxiety level?
My anxiety is really bad.
Yeah. If we were to put on a scale, like where 1 was very little anxiety and 10 was the worst anxiety you've ever experienced, what kind of anxiety are you having on a daily basis now?
Probably like a 10.
A 10, so the worst ever.
Yeah.
Yeah. And checking the doors, checking light switches, unplugging everything, this reduces your anxiety for a while,
Just for a little bit.
but then it comes back.
Yeah.
Yeah. Is there anything else that you do that helps to reduce the anxiety?
It's just, I guess when I'm in the act of doing it, it will relieve it, and then I'll be okay for a little bit of time. Like even coming in, you know, I saw that you had chairs and some pictures, and I just I had to touch them, like I had to touch the chairs, but I wanted to touch the chairs first and then the pictures, and that's normally what I do in a room. Like I have to touch the chairs first, and I feel okay when I'm doing it.
Mm-hmm.
And then when I'm finished, I feel a little better, but then it comes back, the anxiety.
Do you know how long you've had these symptoms?
Probably since, I guess, like 3rd grade, maybe.
So sometime.
Yeah.
Did they start off like they are now, or are they different?
It started off with a little bit of things, like I would just get a little bit of anxiety, and I just would want to play with the doorknob.
Mm-hmm.
And then as it went away for like a year, maybe, and then I would start to play with the lights and just make sure that they were off.
And was it the same thing that helped reduce anxiety?
Yeah. Yeah.
Did it cause you any trouble?
My parents didn't really like it. They kind of were like, you know, something's wrong with you. You know, stop playing with that.
Were you ever taken somewhere and diagnosed or treated?
No. My parents just thought it was like nerves.
And now it's the worst it's ever been?
Yeah. Yeah.
Do you feel like you're able to go back to work with the symptoms the way they are now?
Probably not.
Because they're so disruptive?
Yeah.
Yeah. Have you ever had any medical conditions?
No.
Nothing?
Mm-mm.
All right. And have you ever used or do you use any type of drug or alcohol?
No.
None?
Mm-mm.
All right. Emma, I want to thank you for coming in. I'm going to get you scheduled to see one of our counselors. I appreciate you spending this time with me. It's helped me to understand what you're going through.
Thank you.
Thanks.